Thank you for joining us for Public Safety Echo. The Public Safety Echo project is the world's first of its kind effort to use the Echo model to address safety issues by bringing residents, workers, and businesses together in an online social and professional space to share skills, increase knowledge, and solve problems. In weekly sessions, Public Safety Echo teaches skills, educates partners in different aspects of a healthy community, and empowers community members.
All right. Good afternoon, people. I'll go ahead and welcome you to the Downtown Public Safety Echo. I was waiting for my officer to sign on. I have a downtown officer who's supposed to be signed on to help facilitate, but of course I can manage. I can manage fine without it. So maybe he'll pop on in a minute. But yes, welcome to the Downtown Public Safety Echo. I'm your host, and it's almost my favorite time of year. I'm a big fan of Halloween as a holiday. So I don't have a costume yet. I have a couple Halloween parties to go to, and I have like a luchador mask, but I wanted to ask people. I'm going to introduce my guests today. I have Lynae and Jasmine from ACS here. And my first question is, do you have costumes? What are you going to dress up as for Halloween?
Oh my gosh, I will go first. Okay. So both of my boys have decided to go sports themed.
Oh, okay.
So I have Happy Gilmore and a Aaron Judge, and they're yes. So they're asking me to pick a female athlete, and I was like, why don't I just be your cheerleader? Like,
oh,
simple.
I like that.
So,
hey,
yeah.
Nice. Yeah, and the golf one seems like a fun one too. Yeah.
Yes.
And you were saying your plans for?
I think I'm going to be Jigsaw.
Oh, right. Yes.
Saw.
Oh my god.
Yeah, see, that was my thing. Who likes spooky costumes and who likes, silly costumes? I was going to go ahead and since I have an audience in my studio here, I go ahead and let them introduce themselves and tell me what they're planning on dressing up as Halloween. Whoever wants to go first.
Okay, I'll go first. Hi, Markella Clinton, field rep for the mayor's office. My partner and I, we were planning to do, he's going to go as Prince Fiona, and I'm going to go as Lady Farquaad. From Shrek and Fiona, we're just going to gender flip it, is what we're going to do. So I guess that counts as silly?
Yeah, okay, yeah. Not spooky, definitely not spooky.
I'm Janet Manry. I'm the president of the Reynolds Edition Neighborhood Association and downtown resident. I'm very lame when it comes to Halloween. I just like fall and looking at other people's costumes.
Okay.
I'm Jerry Bowe. I'm a former transit analyst. I live in the historic district here downtown. I'm also on the board of the Prostate Cancer Support Association of New Mexico as of this year. I went through it last year and made it through. On there, as far as a costume, I had a neighbor accuse me that I had a very intimidating, menacing look, so I guess I don't have to wear a costume.
Oh, okay. Van, do you have any plans?
I'll have a Dia de los Muertos costume set up.
Nice.
Kind of the theme I'm going with.
And then we have Angelo, who's joined us on the Zoom. He's actually probably a more age-appropriate person to ask about his costume. What are you going to dress up for Halloween, Angelo? Introduce yourself.
So I was thinking maybe Clark Kent for Halloween. I have a Superman shirt and just wear a suit, like a
suit and a tie, but you're going to have an S underneath, right?
Yep.
All right. And tell everybody on the call who you are and what you do.
So my name is Angelo Ragland. I am a chair for the Youth Community Policing Council, and we've been starting this since this year. Finally got members, but we originally started back in January 2023.
Oh, okay, great. Well, let me get on with sort of the official stuff here real quick. I think I was looking for any new faces that had joined us on the call. But let's please turn on our cameras if you're on the Echo. It's all about all teach, all learn, and we hope you plan to participate fully. Please take a minute to type your name and organization in the email in the chat, especially if you don't have a camera or mic. And please update your name in the Zoom display. And like I said, I introduced the folks that were here. It looks like I'm seeing some of my regular friends on the Zoom, so we'll just go on. Oh, hey, someone snuck in on us. Okay, we'll get to him in a moment here. And I was still looking for my officer to pop on suddenly. But the downtown public safety goal is to increase safety, to bring residents, workers, visitors, and businesses together in an online social space to share skills, increase knowledge, and solve problems. Any views expressed by police officers or participating city officials is not meant to give legal advice and are only meant to educate and provide insight into the discussion. Today's presentation will be on the school-based violence intervention program, and as we know, I have Jasmine Desiderio, Deputy Director, and school-based VIP Coordinator Lynae Lovato. And as we saw, Angelo joined us as well to talk to us a little bit about the Youth Police Council. I'm getting my tongue tied. Youth. Kelly, help me out. What am I trying to say?
Policing Council.
Yeah, okay. Go ahead and introduce yourself too. And you missed out. We're also asking what you're planning on wearing for Halloween.
Oh, I do not celebrate Halloween, but I am Kelly Mensah. I am the liaison for the Community Policing Council in the city of Albuquerque.
Fabulous. Thank you for joining us. Angelo, I'm gonna put you on the spot. Did you want to tell us a little bit more about the Youth Citizen Police Council and what you guys do?
So yeah, so my job is to run the meetings, to have kids, to ask questions for guest speakers. For the past whole year, we have done crime scene specialist talk to us at their crime lab. We have done last week is 911 operator. That way they can ask like what to expect if on a phone call, if what they need to take something, have an emergency. And then we have done police officers. We've done like a little bit more than I expected, but we have grown so much for having kids to know their safety and who need to talk to if they're having a situation, or family members or friends on a daily basis.
So this is information you're learning and using in your life, or are you guys actually planning on entering law enforcement?
So there are a couple students who want to become law enforcement. Some want to be doing law. So we try to get these kids to know what they want, and then how to like contact with them if they like, for example, we have a person wants to do a normal 911 operator to see if they how to get there, or what are the benefits and what their responsibilities. So like I give them like a little bit early step, I can say, to know what they want as their career path.
Well, yeah. I remember I joined you guys on the tour of the evidence lab where they analyze the evidence and stuff, and there were a lot of different jobs there, and there's a lot of jobs in law enforcement. What were you interested in?
So for me, I'm interested as a crime scene specialist on the investigation side, because I think for me is at least to help people on the safer end, like for if people don't want to become a police officer, like, so that way, like, to know what you expect on, and just trying to see what they feel like and what they're fit in as a before they get a job, and if they like it, and then they can see what they're proud of. That's what I can say.
Yeah, a way to find a way to help the community. That's a good thing to aspire to. Well, thanks a lot for hopping on and explaining that to us. I plan on working with Kelly and in the new year, find a time to have you guys come on and talk a little more and share some of your experiences. I think I definitely know it was fun to go tour the evidence lab with you guys and see all the stuff they have hidden in there in the corners. But thanks for joining us, and I'll move on. I was waiting for some more people to hop on the session here because I wanted to have time for some announcements. Let me see if my officer has joined us. I don't see him. Laura, did you have anything you wanted to announce? I know we have the 28th at the university command. There's isn't it a coffee with the cop there, or?
Yeah, it's National First Responders Appreciation Day, so it will be between 7 and 11 at the University Area Command, 1009 Bradbury, and we'll have the Dunkin' Donuts mobile there, so stop by if you can for coffee and donuts.
Thank you. I always like opportunities for free coffee whenever I can get them. And also, I know that you guys are having something for Halloween. That's why I was asking about the costumes, because I'm going to see if I can, if I'll be scared if I go over there and see Lynae in her Saw outfit. But yeah, you guys are obviously having a trunk or treat on the 31st.
Yes, and it'll be at our ACS headquarters off of Catherine and Gibson.
Nice.
Yes.
And any other things that will be there other than just some candy, I assume? And again, I know that there's also a call for people to bring candy?
Yes, we were actually asking for donations. We have invited a lot of our partners that we work with in the community to also attend as well. So this is truly a big community event. We're allowing, hopefully we all come together and have a safe
Cool. And bring good candy. Don't bring the, come on. I know how people are, so, let's bring the good stuff. Any other announcements from the community? You guys have anything? Oh yeah, Jerry wants to.
Yeah, so just want everybody know the Prostate Cancer Support Association New Mexico, that's been here 30 years. They're having their 14th annual conference. Is going to be held a week from Saturday, November 1st at Sandia Prep, and it's 8:30 to 12:45, and it's a free event for patients, survivors, caregivers, loved ones, and spouses. We have 2 support group meetings, the first and third Saturday of the month, that spouses do come to the meetings also. And there one person will be talking, he's a radiology oncologist, about updates in radiation. Another one, hormone therapy, to talk about, a medical oncologist. And this person also is going to be speaking at a national conference in Berlin next spring. And then another person to talk about mental health matters, and another one talks about sexual health.
Great.
So it's a good group of presenters and can provide a lot of education information for people.
Thanks, Jerry. And also, since October is Domestic Violence Awareness Month, last week at the University Area Public Safety Echo, I had Glenn St. Ange of the Domestic Violence Resource Center on there speaking, and I just wanted to extend that they are also having an event to raise money for, which I found out is all funded by nonprofit funds and public funds. So, not by donation, not by the actual city. So you can visit dvrcnm.org/donations if you'd like to make any donations and find out about their Power of the Purse. They're having a fundraising event that will be Tuesday, October 28th from 5:30 to 8 at Revel. I would definitely recommend trying to support the DVRC if you can. It's a really good organization. And you guys work with them a little bit too, I imagine.
Yes, we do.
Yeah, let me go ahead and I have my little introductory spiel here. Because I was waiting for my officer to show up. He was supposed to help me with some of this reading material here. I was telling Lynae I have my contacts in, so it's hard for me to read. But anyway, ACS has been working hard to address many of the issues in Albuquerque, dealing with homelessness, substance abuse, behavioral health. But the term I like to use, the youth are our future, and we need to start looking at these issues a little sooner and helping our future leaders to make better choices, and those choices when those choices matter the most. And that's really what your program is about. I'll get situated over here with the slides, but if you guys want to start sort of telling us about your program, how it came about, and the successes you've had.
Yeah. So to get started, I think it helps paint a bigger picture if we're able to explain ACS as a whole. And the Albuquerque Community Safety Department was created and implemented back in 2021. We are in alignment with the police department and the fire department, which means when you call 911, you have the ability to get either a police officer, ACS, or an AFR, depending on the type of call. And ACS has done an amazing job. I mean, we were out there 24/7 and have been 24/7 since August of 2023. And we have really placed emphasis on ensuring we're the right response at the right time, right? And when I say that, it's really important because, if you want to go to the next slide.
Sorry, that's me.
What's really important is that the alignment that we have with police and fire is important because we do see the benefit of working collaboratively, right? We are a public safety department here in the city of Albuquerque, and it really places the emphasis of ensuring that public safety departments are providing additional supports, even if it's prevention or intervention services, right? If you go to the next slide, it also wants to put emphasis on the way the department is organized, right? Within ACS, we have 3 different divisions. We have our director, Jody Escobar. We have our field response division, which is really our field responders that are dispatched by 911. We have our admin support division, truly those who are focused on training, quality assurance, finances, HR, all of the good stuff, right, that keeps our program, our department operating. And then we have the violence intervention program. Our violence intervention program really places an emphasis on ensuring that there are additional support services that are provided to community members, youth, as we're going to talk about today, to ensure that they're connected to resources and services out in the community. And a quick overview, I wanted to provide emphasis on what field response means. So we do have 4 different programs or responder types. They range from higher acuity to lower acuity. We have our mobile crisis team clinicians. They ride with a sworn police officer, and those are our mobile crisis teams. We have our behavioral health responders. They're 2 trained professionals that ride in one unit together, and they respond to 911 calls. We have our community responders. They respond to lower acuity calls, and our street outreach responders that address calls to do with the unsheltered population. And then the division that we're going to be talking about now is our Violence Intervention Program division. Within our division that I oversee, there's 6 specialized teams. Within these teams, they really focus and hone in on different areas that we've seen gaps in, right? So when we're talking about prevention and intervention, it takes a holistic approach to ensure that we're providing either early intervention, intervening as soon as possible, but also providing the benefit of saying, hey, you know what, you did mess up, but we're going to help you so you don't go back into that cycle. And we have our violence intervention program. It's the same program that has been operating for the past couple of years. It is a collaboration with the Albuquerque Police Department. So when there is a situation that happens here in Albuquerque that requires a custom notification, we actually deliver those with a peer support worker with an APD detective.
Yeah, I've been fortunate enough to go on a call with them,
Yes, and then we have our hospital-based violence intervention program, same concept, but we actually work and receive referrals from a university, UNM hospital for the trauma unit. So anyone that is entered with a violent traumatic injury, like a gunshot wound, stabbing, anything like that, we'll be able to go and provide services bedside, so that we're able to get them services as soon as possible. The third peer-led program that we offer is the Opioid Education and Prevention Team. They are peers that have lived experience, so they get sent out and do follow-ups for overdoses that happen here in the city of Albuquerque. We also ensure that we have our teams follow up with those who have been identified to receive the golden opportunity in here. So through 911, if a person is deemed eligible through AFR, they get ACS out, and ACS gets our OEP team out, and we're able to follow up with that individual once they start their detox, so there's no gap in services.
Do you mind if I ask you to define that golden opportunity moment?
So the Golden Opportunity is an initiative that we work with the fire department as well as some community-based organizations, where if an individual is an active overdose, a call that comes through 911, the medical team, emergency medical team out there would go through a medical criteria to see if an individual is eligible to either get Suboxone instead of the Narcan. And if they accept the opportunity, we ACS is contacted to do a transport, and they contact the OEP team so that we're able to get our peers involved sooner, and then take them over to a bed that is available at a detox location. And that starts their detox immediately in their journey.
Fabulous.
So, which
Catch
is amazing.
at that moment,
And then we have our CORA, which is our Community-Oriented Response and Assistance Team. They actually respond to and truly focus on community healing. So if there is a homicide or shooting or stabbing in the community, we do community outreaches, ensure that anyone who is involved or seen receives services or connection to services. So we're really focused on vicarious trauma, right? Making sure that everybody has equal access to those type of resources. They also respond to specialty types. You're talking about the DVRC. It's the team that they would work closely with. So anything to do with domestic violence, sexual assault, human trafficking, homicides, things like that. And then the two last programs that we have, which seems like a wealth of information I'm sharing, is really focused on youth, right? So we have our school-based violence intervention program, and we'll go more into depth on that, but it is a mentorship program, an initiative that right now is in 4 high schools full-time, which means that we have interventions specialists there. And then we also evolved into, we've identified some gaps early on this year that students who were in the school-based violence intervention program, or students who we received referrals from but are no longer enrolled in school or attending school, we wanted to ensure that we had a program that focused specifically on them.
Follow-up.
So we implemented our youth violence intervention program that does work in collaboration with our school-based violence intervention teams.
Great.
Yeah.
Well, I mean, that actually makes me want to. Your VIP program is a big component of what ACS actually does. I mean, I definitely feel the prevention aspect, pays a little more dividends than the responsive, but
yeah, and I think it's always been a vision, right? It's always been the approach to ensure we're providing that holistic approach, and now this division is true to that sentiment, is we are providing the follow-up, because we could respond, our responders are doing an amazing job out in the field, responding 24/7, de-escalating situations, but then they also now have the ability to send referrals to our teams, who then can take additional time to focus in on what are those root causes of what's going on. How are we going to ensure that the individuals that we are encountering that may be eligible for our program and actively want to participate in our program have that support?
Yeah, that sounds great.
Yeah, so I'm going to hand it over to Lynae, who's going to talk more about the school-based violence intervention program.
Fabulous.
So basically what we've seen the last couple of years is that 11 out of 13 APS high schools have had a firearm on their campus. We've also seen a spike in juvenile crime, and you can see some of the data on the slides. And this ranges anywhere from homicides to gun charges, car thefts, anything like that. And what we've seen is that there's obviously a lot of youth programming here in Albuquerque, but what we've seen is that there's a need for something that's a little bit more long-term and approaches the situation a little bit, just like Jasmine said, holistically. So addressing some of the challenges that youth are facing right now, and a lot of that is easy accessibility to guns, the influence from their peers, being involved in gangs, and then just personal challenges that they're facing.
And I mean, I bring it up, it feels like I bring it up all the time, and social media really seems to be something that's driving a lot of just the changes in how they perceive this stuff and behave around it. Do you guys deal with that a lot too?
We do.
Yeah.
We do. We see it a lot, and some of the referrals that we're getting, that's how we're getting them,
Yeah.
is based on some of the things that youth are posting on social media.
Yeah.
So we could go to...
Am I on the right slide?
Yes.
Okay.
So SBVIP started in 2022. The program, we piloted the program at West Mesa High School, and I'm sure most of you are familiar, there was a shooting near campus that resulted in a homicide. It was found out that both youth were group or gang involved. There was a firearm involved, obviously, and then a lot of the kids that were on campus were impacted, and there was a lot of conversations about how to manage retaliation on campus. So that's when we decided that that would be the school that the program piloted in. We started with one intervention specialist there, and there was about 15, 20 kids in the program at that time. Since then, we've expanded to 4 high schools, so we're still currently inside West Mesa High School. We've expanded to Atrisco Heritage, Del Norte High School, and then RFK, the charter school. We currently have over 100 active participants in our program, and then we also identified some gaps, and that's where we evolved and started the Youth VIP team as well.
Okay. So you also have youth involved with some of these, I guess, interventions that you're doing, or is it just your navigators or the people that you have staffed there?
So the intervention specialists are the ones that provide the mentorship to the youth in the program. But what we have seen is that some of the kids who have been in our program
that's what,
for longer periods of time, a full year, 2 years, that they do kind of take on some of those newer participants and younger kids and try and provide them some peer support too.
Of course.
Can I ask a question?
Sure.
So the schools that you're in, is that based upon the schools with the biggest need? I know you see like West Mesa High Schools on TV a lot. Is that where you started?
There's a lot of things that we review before we go into the schools, and we review some of APS's data. We work with other public safety departments to review some of their data, identify incidents that may have happened on or near the campuses, and then also working in partnership with APS to see where they really feel like they could benefit from having this program there.
Is a factor that do you have to work with our schools, whether schools are open to it?
Yes.
On there too?
Yes, absolutely.
I mean, I imagine the plan is all of APS eventually, and it's a matter of other logistics that we're hoping to get there. But the schools that you've selected, what kind of success have you had in them?
We do have that in a later slide.
Oh, okay. I'm sorry, I'm getting ahead of myself here.
So if you want to move to the next slide.
There you go.
Just to touch a little bit more in depth on what SBVIP actually is, and it's a trauma-informed, mentor-led program. The initiative is to focus on youth at the highest risk of cycles of violence or being impacted by violence. And also, what we know goes hand in hand is substance use. The ultimate goal is to bridge gaps between schools and the community and be able to provide wraparound services to the youth and the family, and really improve safety in the community and also the schools. referrals are made by APS. So there's a system inside APS that's called the Early Warning Indicator System. And so this is, each school has like deans, counselors, and teachers that are on that, I guess it would be like a committee or a group that meets regularly. And they really talk about some of their higher risk kids that they have in the school. So these are kids who have really low attendance, may be getting in fights a lot, have been shown up to school drunk or high, anything, or they've received like information that this kid has been involved in something traumatic outside of school, those type of things. So that's really how, like at the school level, we receive those referrals. We also work really closely with the APS Threat Assessment Director and APS Police. So these are going to be youth that are probably a little bit higher acuity than what they're just seeing at the school level. These are youth that the district has been informed need more support.
Okay.
So we work collaboratively with them to identify how we can support those kids and ensure safety for them. We also can get referrals, like we have youth that hear about the program from a friend and they're going through something and they'll come talk to one of the intervention specialists on the campus and do a self-referral. We also get referrals from parents or guardians as well.
Okay.
And then we can receive referrals from any public safety department as well. So APD, BCSO, ACS, juvenile probation, any of those entities as well.
Michaela had a question.
Is there an age limit for the children that can participate in this? Like, is it only high school students, or if you know of, let's say, a particularly aggressive 9 or 10-year-old that would benefit from this, could they be referred?
We are currently exploring what that looks like. We do have a couple of cases that are elementary level kids, but the majority of our cases are middle school or high school level.
But we do also work with other outside agencies and organizations. So if our program is not the best fit, we'll make those referrals directly to those organizations so they can continue providing services. And sometimes it often looks like having them start counseling or therapy sessions or getting referred to another program that might be able to help that is age appropriate.
Okay, and those would be like local and their parents are able to participate every step?
Yes.
Okay.
Yeah, and before any participant is enrolled in the program, we do need parent permission. So this is just not, oh, you're here with us, or it's not a punitive program either. It's more of a collaboration between the parents, the schools, and our program.
It makes me think of that shocking video that went around earlier with the young boys with the pistol that the sheriff's deputies had to disarm, but that's where we're at in the modern world. I'll let you, I've advanced the slide.
Oh, yeah, okay. I just want to touch a little bit on the services that we're currently providing. So it is, as Jasmine mentioned, we do have a therapy component to the program. One of our partners, what we've done is they actually have APS background checks as well. So they have the ability to go on campus and do sessions with youth there at school. And we coordinate that with the school just to relieve that barrier of them having to go to a different site or anything like that. We also provide educational support, any basic needs that they may have, and extend all of that those services to the home as well.
Okay. More question, Michaela?
When you say basic needs, do you mean like with food and personal hygiene items?
Yes, so food, personal hygiene, we've done rental assistance, utility assistance, we've helped families apply for Medicaid, and just helping them through the application process for all of those things as well.
Yeah, because if you don't have that, education is going to be secondary.
Do you work with CYFD?
Yes. So primarily our partnership with CYFD right now, what it looks like is with their juvenile probation division. So some of the really bigger picture outcomes that we have is there's been a 208% increase in participants, and that's been from December of 2024 to May of last year. We also, most of the youth in our program, we see a 28% increase in their GPAs. And the very first year that I took over the program, it was the second year of the program, but we had our very first graduate.
Yes.
And we were super excited. And then last year, we actually had 83% of our seniors graduate. So it was 5 out of the 6.
Yeah.
And we recently were informed that the sixth participant just recently graduated. So
that's huge. Especially here in New Mexico, I feel that that's like the biggest goal, just to get them across the finish line.
yes, so we were very excited about that.
I have a quick question too. Is this done on sort of a one-on-one, or do you guys have group settings or a variety?
That's a great question.
Thank you. That's what I'm here for.
Initially, the program was drop-in. So kids would drop in as needed throughout the day or at the beginning of the day, end of the day, to get support just based on when they needed it. In some of the schools, in Atrisco, West Mesa, and RFK, this is actually an elective credit course that's co-facilitated in partnership with the teacher.
Okay.
And we developed a life skills curriculum for them, and we developed it based on other evidence-based programming that was effective across the nation, as well as based on the needs that we saw from the kids that we were working with for the prior year and a half.
Wow, that's great to hear. I wasn't aware of that. Yeah.
So you'll see on some of the slides, there's some quotes. We went through an evaluation, and so these are some of the feedback that they got, and the evaluation is on our website too if you wanted to go check it out. But this is a picture of some of the graduates. We actually had our own graduation ceremony for them, where we were able to celebrate them, and it was really neat to see. They all wore their cap and gowns from their schools that they went to.
Yeah.
So
it was at the museum. I went. It was very nice.
yes, it was a really nice event. Some of the other successes we've seen is that there's been an 83% in decrease in major offenses and an 84% decrease in minor offenses for you
That's good to hear.
that are in the program. I do want to touch a little bit. There was a story on the previous slide,
I
but
can go
it's
back.
We've had a lot of kids that were not passing any classes when they came into our program, and we really, once we're able to get them stabilized to the point where they're attending school more often. Maybe we've helped with like food boxes, utility assistance, relieve some of the pressures at home. We've seen that we've had some drastic increases in grades. We've had kids go from failing all of their classes to the next year being on honor roll.
Yeah.
And so those are some of like the big wins that we've seen.
Yeah. Well, I mean, a lot of these kids are just lacking that simple opportunity to show that they can. Yeah.
So that's been really awesome to see as well.
How do you gain their trust in order to be in the
I think that's part of the trauma-informed approach, right? But a lot of it, I have to give credit to my team as well. They really have a way of working with the kids and talking to them where the kids know that they're not talking to them to get them in trouble. They're really there to support them and really listen to them and hear what they're saying. A lot of the feedback we get from the kids is that nobody really listens to them, that a lot of people talk at them or tell them what to do, and they don't hear about why they're having challenges being successful in certain areas.
Yeah, talking down to them and sort of giving them the impression it's all their fault.
Yes.
When in reality it's so many other things.
Yes, exactly. Exactly.
I would have needed somebody like to understand what the hell was going on at home. Like, that it really could be that bad or could that be weird or whatever. So.
And sometimes it's just a difficult thing to talk about. At least having your staff allows them, a safe place to open up about that stuff.
Yeah, absolutely. I have a really great team, and they know these kids in and out and their struggles, and have walked alongside a lot of them. And there's a lot of accountability, and it's different when it comes from a mentor versus a teacher or a parent sometimes. And so they've been really successful with the kids that we have.
Yeah, that's good to hear.
Some of to put numbers behind the impact. Like I said, we have 110 active participants. We've worked with over 230 youth since the program started. We've received 130 referrals this year. And we have over 40 kids enrolled in the elective courses that we offer. And then these are some of the issues that we talked about that are identified in like the early warning indicator systems or referrals that we get. These are the 4 highest things that we're seeing when we're getting referrals. So it's for low attendance, fighting and gang affiliation, requesting mental health support, and being highly impacted by a violent crime, and substance or alcohol use.
And would you even say there's a higher priority of the 4? I mean, are they all equally affecting the youth, or is there one that sort of stands out a little more?
I would say the referrals that are received across all the high schools, these would be very close top 4.
Okay,
right? There are, I wouldn't say there's higher or ranking them.
Yeah.
I feel like a lot of it, they're codependent on each other, right? You're going to see low attendance because they got a fight and now they're suspended, but they're also a part of the gangs, and that could be because they were highly impacted when they were younger and also using. So I think a lot of it requires us to understand most of these students are involved in a cycle that can't be broken because we're a part of a system that continuously tries to identify and put labels on, like, oh, you did this because of this.
Right.
But not truly understanding the reason why certain things happened. And I feel like this program has done a really good job in ensuring that our intervention specialists that are put within the schools understand the issues behind some of their actions, right? We have some students who are the breadwinners of the family, meaning that they're the ones who have to make money or fast money. That's what they're doing in order to support their family or in order to have a house to live in. And if we're able to make that connection with the participant, then we're able to really identify what does it mean to address those basic needs so that burden is lifted and they can actually focus and attend school. Right, so we really are focused on ensuring that these students have the ability to work on that relationship with us, trust us, but enough so that we're able to help.
Right. So they all sort of in the Venn diagram would overlap, and you guys are right in the center there.
Yeah.
Absolutely.
And that's our school-based violence intervention program, and I guess we're open for questions.
Is that the last slide? Okay. I was trying to switch it here. There we go. Oh, okay, questions. There we go. We were asking questions all along because it's a very interesting program as well. Anyone on the call have any questions for the ACS staff here? You can shout it out or raise your hand. I don't see anything. Let me look in the chat.
I do have one question.
Go ahead, Jared.
So I guess the overall frustration that a lot of people in the community have, and they're generally from stable families or friends or neighbors going on. And what they're seeing with the youth and everything, it's like, the big question is always, where are the parents? That comes up. Is that a huge issue? Is that the bigger part of the issue? Or what are the bigger parts of the issue for the overall?
I think easy accessibility to guns is a big issue right now. I think with our participants, we do have families that are super engaged, but we also understand that some of the kids in our program live with a single parent who is working 2 or 3 jobs just to ensure that they have somewhere to live, which then means that they are home a little bit less with this young adult or child. And a lot of the time that kid is they're teaching themselves how to live, or figure out what they're going to eat for dinner or feed their younger siblings, things like that.
And the gun issue, I mean, it's been brought up in other RECO meetings by police, the frustration of telling people not to leave guns in their vehicle, and they still do. And so they can just break in a car or whatever and get it pretty easily on there. And it's a frustration of, what the community can do.
Yeah.
Mm-hmm.
Simple things. Don't leave things in your car.
Yeah, and then again, I mean, it's also just, like I go back to social media and the fact that these, items are easily sold and transferred that way. Mm-hmm. And we also have the issue of ghost guns and the sears that they can attach to them to make them even more deadly. So, I mean, it's a complex issue because we have so many of those weapons circulating out here. But I was looking for other specific questions. Any others in the audience here? Did we cover everybody?
There's going to be more.
What are you scheming over there? Did you have something you wanted to add?
I think she had an answer to your question as well.
Oh, okay, go.
No, I was just going to say, I think what we've seen over the course of the program, and even within violence prevention, pinpointing it on one particular topic or issue really is more of like Pandora's box, right? There's a lot more things that are occurring in an individual's life, and one of the benefits of this program is we actually tailor our response to that individual or to that student. So ensuring that our intervention specialists are understanding more of the situation, so we're able to say, oh, actually this might be better for you than this other thing. And I know Lynae touched on it during the presentation, but we also have the elective course that is really focused on life skills, right? We're really trying to get the concept and teach the students, feeding them the information about the awareness, the prevention, but also letting them know what accountability looks like, right? Okay, you do this, you're a kid, but once you reach this age, this could happen to you, right? I feel like even in all of psychology, talking about kids who think they are invincible and nothing can ever happen to them, and you're like, actually, you're almost an adult. Like, let's teach you these things now and try to let them know what that means about responsibility, accountability, and getting them more empowered to take those decisions a lot more serious.
I think the biggest thing you said, the biggest impact is just that you're listening to them. No one listens to me, everybody tells me.
Yeah.
And that's making a huge difference in the reason for the success for your program. So it's awesome what you're doing.
And nobody understands.
Yeah, that's even, I grew up here, and I think I mentioned before that I wasn't really the best kid growing up here. You also sort of feel like if no one's listening, then what I think is right or is best for me is sort of the driving factor in your decision-making process. And again, just having that other person to speak to and bounce some of those decisions off of that might guide you in a better direction, because I feel you can easily make a choice that will change your opportunities for the future and then lead you further down that road of bad choices.
Mm-hmm. Yeah.
And a lot of times people are judged.
Yeah.
And once you're judged, it's hard to get out of that, so that people don't know your whole story or anything what's going on, and they continue.
Yeah, you call me a gangster, I'll act like a gangster.
Yeah.
So yeah, no. I was looking for other questions in the chat. I don't seem to have any. And I believe we have exhausted all the queries here in the audience. But I definitely, this program, like I said, and also learning about just the expanse of the whole VIP program in general has been very informative. And I definitely look forward to growing. And I mean, since day one, I felt like it needs to be in every school, every middle school. And now that I know it's an elective and those life skills, that's exactly the thing that I think has sort of been cut out. I know when I went to high school, you had a requirement of knowing civics and health both before you could graduate, and I believe those classes have fallen by the wayside. And a lot of what we're talking about are just health issues, safety issues, civics issues. So I'm glad that your program is able to sort of serve that as well.
Thank you.
I was going to also sort of talk about some of the changes that I'm trying to craft for the ECHO program going forward. I was looking, is Elliot still with me? No, well, I will just let you know that I now am Elliot is there with me. I am now putting these sessions onto a YouTube channel, so I will archive this session on a YouTube channel. You can search it on YouTube very easily at Public Safety ECHO, and the sessions will be archived there. And now that Elliot's popped back on, I was sort of going to let people know that I'll be communicating with them about moving over to our iECHO platform. In the next coming sessions, we'll talk a little more about that and give more details, but it's hoping to improve some of our communication and just how we share information. And I'll let Elliot give us a little quick spiel real quick.
I I think I spoke last time, but I'm happy to just reiterate. Like Darryl said, my name is Elliot Paras. I'm with Project ECHO. Like Darryl said, yeah, we're just going to be helping him transition the ECHO over to our iECHO platform, which is where we conduct the majority of our other ECHO sessions. So mainly, really nothing will change in terms of how the sessions are ran, but the only thing that will change is how you access the sessions. So once we are on iECHO, you will all register as a participant of this program, the Downtown Public Safety ECHO, and then you'll receive automatic emails that prompt you to join the session 30 minutes prior to them beginning. So this one begins at 1, so you'll receive an email around 12:30 with that prompt to join. Like Darryl said, iECHO also offers like a bunch of different other benefits. So we can upload resources to iECHO. We can look up other participants if we want to collaborate with them. But it's just a way to sort of house all of our various things for our programs. And so, like Darryl said, we're not going to do it like right away. We're still meeting to figure out like the best.
It's a plan process for the new year, just letting everyone know so I can navigate everything over. And like I said, over the next few sessions, we'll definitely take some time to sort of illustrate what's going to happen so that we can have you all join us over there. But thank you,
Thanks,
everybody. Thank you for joining us today. Thank ACS, Lynae and Jasmine. Again, the work you're doing is like amazing, and I'm sure I'll be bugging you guys in the new year about talking more about the development and as it grows.
It's never a bother.
Okay, good. Well, and again, like I said, it's any aspect of it I've been able to participate in has been amazing, and I definitely feel like it's one of those things that I definitely hope we can quickly find ways to expand. And again, like I was saying, I'm old school. I just feel like we got to start at the schools if we're going to change any of these issues that we're facing down the road.
Yes.
Instead of trying to put Band-Aids on things after the fact. So thank you so much for joining us. Thank everybody here in the audience who joined us as well. And everybody on the call, thank you. Next time we will be talking about encampments. I believe I have the APD encampment people joining us, so I will talk to you then. Have a safe Halloween if you do that sort of thing, and see you at next Echo.
Thank you for joining us. We welcome your suggestions regarding any scenario involving future public safety echo sessions. For more information, visit www.cabq.gov/echo.